So, what advice do you have to someone who feels dismissed by other doctors? So, usually this happens.
Uh, if I have to tell, oh, the patient have to write a book. Uh, yes, this is terrible thing. It's a terrible thing. I remember a lady who saw 9 infectious disease doctors. Only the last one thought of Lyme, and she saw a cardiologist. Or the cardiologist told her, word by word, I repeat, I don't care of your Lyme. And so I explained to her that she was not crazy. She was not crazy. She was Lyme, and she was crying.
Yeah.
Things that telling me she's not crazy. She's not crazy, and it's very difficult because she was convinced that she was crazy. So
Mhm.
yes, to be told that you are crazy, or it's mental is difficult. So there is what to do when a doctor dismisses you. So
Yes.
this is a very big question. I can tell you that the problem is that if I know a subject because I studied the subject, I'm ready to discuss with you.
Mm.
If I know the subject or because I pretend to know the subject because I just repeat like a parrot what other doctors say, and because the other doctors have the merit to have some initials behind the name,
Mm.
you cannot discuss. It's such a prejudice, so bias. So
Yeah.
you cannot really, it's impossible that you, board certified in family practice, can even dare to say a word contradicting infectious disease doctors. They just,
Mm.
I even don't want to go in any further with you. How can you dare to do that?
Mm.
So you cannot really do things, uh, and there is I have example, or a doctor did not even did not acknowledge the healing of patients, uh, So having a patient who came for bipolar disorder, and this 19 years old, and the mother said, we don't have any bipolar in the family. She cannot have bipolar. And the psychiatrist did diagnose the bipolar, and she was on lithium. And so we did test, um, I treated for Lyme with
Mm.
azithromycin. And 1 month after, the bipolar was really gone. 2 months, she was okay, she was fine. The psychiatrist no way to stop lithium. And
Mm.
so I reduced lithium by myself, but I was scared. I'm not a psychiatrist. So I
Mm.
did in 6 months what he would have done in 2 weeks. And after 6 months, she was no longer on lithium. She saw the psychiatrist who said, I quote, it's a miracle.
Mm.
He said it's a miracle because she did not have any more bipolar disorder. He admitted that she did not have any more. But
Mm.
he did not believe in Lyme, so and he preferred saying that it's a miracle. You cannot really realize. If you want to discuss with doctors, and I think there is a point of discussion here that we can bring in podcast, because I want to give you the opportunity to hear what you never hear. Okay.
Yes. Yes.
Yeah, yeah. This is what I think interest for your podcast to hear. So
Yeah.
the way to, now you have to sit well, because I'm going to give something very interesting.
Mm.
The way to diagnose Lyme is to have bands. Bands are protein attached to the membrane of the bacteria, like pearl. Okay, and you have 10 bands, and the CDC tells you that to have Lyme in IgG, you need to have 5 bands out of 10. And IgM, you have to have 2 bands out of 3. What about if you have 1 band out of 3? You don't have Lyme, but have migratory joint pain, have night sweats, I'm tired, and nothing works. I have 1 band. Nowhere was that. You cannot have Lyme. Go home. You don't have Lyme. No, I have 4.5 bands. You don't have, and I'm serious. Many of your people who are listening to us will relate to that. The doctor said, no, Lyme is negative. Why? Don't have 5 bands. So you stand up and you said, doctor, with all my respect to you, why 5, why 3, why 2, and why 5? Why? Because the CDC said so. But once again, why? The CDC says so. They certainly know why. But you know why. So you will probably hear silence, and you say, I'm going to do a favor to you. I'm going to tell where it comes from. It comes from Dr. Dressler in 1993, I think, in the Journal of Infectious Disease. And I can give you the name, the article. Dr. Dressler and colleagues, as we say, did a study, and they said, we wanted to have a test specific over 90% for epidemiologic studies. So we decided that by raising the number of bands to 5, we will eliminate all false positive. So specificity for people who didn't learn at school, sensitivity means, specificity means that if you have an alarm at your door, which is very specific, you want only Amazon to be able to ring the bell, for it to be you are notified only from Amazon. It's very specific. You will miss people because it's too specific. You want to have something that catch flies, but not bees. Okay? You will miss flies. It's too specific. Now, if it's too sensitive, if your camera at the door is too sensitive, even if a cat passes by, your alarm will ring. So there is this conception in science, in statistic, between sensitive and specific. So the Dr. Dressler and his colleague wanted a test to know who has, without any doubt, Lyme disease. Their purpose was not to diagnose a patient, is to know how many cases we have in America every year, 476,000. It's for sure verified. Their purpose is not to treat, is to know for sure. So they needed to have a test of such a specificity to eliminate all the doubtful cases. Specificity, for some reason, became sensitivity. The study is specificity 90%. And now the rule is to use the 5 bands as a sensitivity to rule out Lyme. You cannot rule out Lyme with this test. If you know the reason why 5 and why 2 is to know who has for sure Lyme without any the shadow of a doubt, is not to know who does not have. Also, how do you know that the test is accurate? How do you know the test is accurate? How do you know that the doctor who tells you, I don't believe you, you don't have Lyme, the test is negative? How do you know it's so correct? Because Dressler took a group of patients who had Lyme for sure, and they did a clinical assessment. And they verified that people who were positive were also positive from a clinical standpoint. The reference was a clinical assessment, the clinical diagnosis that is today stepped on, disrespected, ignored. Dressler used a clinical diagnosis to validate the test. So this is what you can say to a doctor, Y513, and you give the article. And you can also, very interesting, you can go to CDC website and you go to the case definition of Lyme. You will see clearly that the rule of 3 and 5 is for epidemiological purposes and not for clinician.
Clinician, yeah.
It's written. You go to the page, case definition. If you go to the page, diagnosis, you will have the rule that all doctors follow, the ELISA test and the Western blot. But this rule that everybody follow comes from a misunderstanding of the reason of that. It's for epidemiologists. It's not for clinicians.